Hello. I'm Dr. John, and this is the channel where health and education meet. Did you know that HIV can remain silent in your body for weeks or even months before showing any symptoms? And when they do appear, they are often mistaken for a simple cold or other common infections. But understanding exactly when and how symptoms appear can make the difference between an early diagnosis and serious complications in the future. In this video, you will discover the stages of HIV progression, from the moment of infection to the most advanced symptoms, explained clearly and objectively. If you've ever wondered what's a myth or fact when it comes to this infection, or if you know someone who needs this information, stay with me until the end. This content can provide more security and clarity for you to take care of your health and encourage early diagnosis. Have you ever felt unexplained fatigue, persistent fever, or spots on your body and wondered if it was just something temporary? Or maybe you're just curious about how the body reacts at each stage? Keep watching, because what you will learn here could change the way you view your health and give you the power of knowledge. HIV, or human immunodeficiency virus, is a virus that directly attacks the immune system, specifically the CD4 cells, which are responsible for protecting the body against infections. Imagine your immune system as a defense army. HIV acts like an infiltrator, destroying the troops from the inside out, progressively weakening natural defenses. This silent action makes the body vulnerable to infections that would normally be easily fought off. Once HIV enters the body, it settles in the cells and begins to multiply. It uses the cell's own DNA to replicate, which makes it difficult for the body to recognize and combat the threat in the early stages. Many people don't even know they have been infected because they don't feel anything in the beginning. This hidden behavior is what makes understanding the progression so essential, as early diagnosis makes all the difference over time. As HIV replicates and destroys more immune cells, the immune system loses its ability to respond. It's as if the army is getting smaller and weaker, leaving room for the infection to advance. Understanding how the virus works in the body is the first step in recognizing the importance of prevention and regular medical monitoring. But what happens in the first few days after contact with the virus? That's when the acute phase of infection begins. In the first days after HIV exposure, the body starts a silent battle. About 2 to 4 weeks after infection, flu-like symptoms may appear, including fever, headache, intense fatigue, and sore throat. This phase is known as acute infection, and at this time, the virus is rapidly multiplying and attacking immune cells. Many people don't associate these symptoms with HIV because they resemble common viral infections, such as the flu or mononucleosis. During this phase, the body reacts to the presence of the virus by activating the immune system intensely. Swollen lymph nodes, night sweats, and even red spots on the body may occur. However, these signs may disappear within a few weeks, giving the false impression that the body has recovered. This is where the danger lies. The virus remains active, even without visible symptoms. Getting an HIV test soon after a risky situation is crucial for early diagnosis and better control of the infection. It's important to emphasize that, during this phase, the virus is highly transmissible. Even if the person doesn't notice the symptoms or feels fine, they can still transmit HIV. This is when a lack of information can lead to the silent spread of the infection. And when the symptoms disappear, many people think they're cured, but in reality, the virus enters a new, even more dangerous and silent phase. After the acute phase, HIV enters an intriguing and deceptive stage, the asymptomatic period. During this phase, the virus continues to replicate in the body, but more slowly and discreetly. The body no longer shows visible signs of infection, which leads many people to believe they are healthy. This lack of symptoms can last for years, while HIV silently weakens the immune defenses. It's an invisible danger that makes many neglect regular medical monitoring. Although the person may seem healthy, the virus is still active, gradually destroying CD4 cells. To better understand, imagine a castle being slowly corroded from the inside, without cracks showing on the outer walls. When the first signs appear, the immune system is already significantly compromised. That's why regular testing, especially after risky behaviors, is essential. Even without symptoms. During this period, HIV can still be transmitted to others, which reinforces the importance of using condoms and regular testing. Unfortunately, the absence of visible symptoms can create a false sense of security. However, when the immune system starts losing its ability to protect the body, the first visible signs of the infection's progression emerge. As the immune system weakens, the body starts sending more evident signals that something is wrong. The initial symptoms may seem harmless at first: extreme fatigue, night sweats, unexplained weight loss, and recurring infections such as oral thrush and herpes. These signs indicate that the body is already struggling to fight off infectious agents that would normally be controlled with ease. It's as if the defenses are giving up, allowing small invasions to occur more frequently. The danger is that, even in this phase, many may still not associate the symptoms with HIV. For example, weight loss may be mistaken for stress or poor diet, while recurring infections may be seen as bad luck or temporary low immunity. However, these symptoms are a warning that the body is asking for help. This is the point at which medical monitoring and laboratory tests become even more crucial, as they reveal the CD4 count and viral load, essential indicators for evaluating the progress of the infection. This phase can last months or years, but without proper treatment, the immune system continues to deteriorate. The virus relentlessly advances, and the risk of more severe infections becomes a real threat. When the immune system is already severely compromised, the body enters an even more concerning and critical stage. At this stage, the immune system is severely weakened. The CD4 cells, which once acted as the frontline defense of the body, are at extremely low levels, allowing opportunistic infections and severe diseases to manifest. Symptoms such as pneumonia, tuberculosis, fungal infections, and even certain types of cancer, like Kaposi's sarcoma, become frequent. It's as if the body is unprotected, vulnerable to any external threat. AIDS, which stands for Acquired Immune Deficiency Syndrome, represents the most advanced stage of HIV infection. It's important to note that not everyone with HIV develops AIDS, especially when treatment is initiated early. However, when there is no proper control, the virus can cause irreversible damage to the body. At this point, symptoms such as extreme weight loss, persistent fevers, and chronic diarrhea become common, drastically impacting quality of life. Despite the severity, medicine has made significant advances. With antiretroviral treatment, many people are able to recover part of their immunity and live a long and healthy life, even after an AIDS diagnosis. But how can you know if you're infected before reaching this point? This is where early diagnosis and specific tests play a vital role in preventing more severe complications. Identifying HIV early is crucial to start treatment as soon as possible and avoid complications. There are different types of tests, such as the rapid antibody test, which detects the presence of the virus in just a few minutes, and the viral load test, which measures the amount of virus in the blood. The most common test is the antibody test, usually performed with a small blood sample or oral fluid, capable of identifying the infection after the so-called window period, which lasts about 20 to 30 days after exposure to the virus. For those who had recent exposure, the combined antigen and antibody test is a more accurate option. as it detects HIV earlier by identifying both the immune response and the presence of viral proteins. Many are unaware, but the diagnosis can be done for free in healthcare units and even in approved home tests. The sooner HIV is identified, the greater the chances of effective infection control. The biggest challenge, however, is overcoming the fear and stigma around the test. Many people avoid getting tested out of fear of the diagnosis, which can delay important treatments. Getting tested regularly, especially after risky situations, is not only an act of personal care but also a collective responsibility. And when the diagnosis is confirmed, the next essential step is to understand the available treatment and how it can completely change the course of the infection. HIV treatment has evolved extraordinarily in recent decades, turning the diagnosis into a manageable condition. The main approach is antiretroviral therapy, ART, a set of medications that prevents the virus from replicating in the body. This treatment drastically reduces the viral load in the blood, often to undetectable levels, which, in addition to protecting the person's health, eliminates the risk of sexual transmission of the virus, a concept known as undetectable untransmissible. It's important to emphasize that the treatment doesn't cure HIV, but it allows the person to lead a long, active, and healthy life, similar to someone without the virus. To achieve this, strict adherence to treatment is essential. Taking the medications correctly, without failure, prevents viral resistance and maintains infection control. Many patients report that after starting the treatment, they regained energy, healthy weight, and overall well-being, showing the power of ART when followed rigorously. In addition to ART, healthy habits such as a balanced diet, regular physical activity, and frequent medical monitoring are pillars for effective HIV control. And just as important as the treatment is breaking the stigma, being on treatment does not define a person, nor does it make them a threat to others. However, ignorance and myths are still barriers that need to be dismantled. There are many myths and misinformation about HIV that still persist, negatively affecting how people deal with the infection. One of the most common myths is that HIV is an immediate death sentence. In reality, with proper treatment, people with HIV can live a full and healthy life. Another widely spread myth is the idea that HIV can be transmitted through casual social contact, such as handshakes, hugs, or sharing utensils. In fact, HIV is transmitted exclusively through bodily fluids such as blood, semen, vaginal fluids, and breast milk. This misinformation creates a harmful stigma that makes people with HIV vulnerable to discrimination. The truth is that, with medical advances, especially ART, people with HIV can live just as well as anyone else. Furthermore, the concept of undetectable untransmissible shows that when HIV is undetectable, sexual transmission is virtually impossible. Still, fear and lack of education continue to fuel prejudice. Another misconception is thinking that HIV doesn't affect groups outside of those considered at risk. In reality, anyone can contract HIV, regardless of age, gender, or sexual orientation. The only way to prevent infection is to protect yourself adequately and get tested regularly. Therefore, it's essential to seek accurate, up-to-date information and support initiatives that promote HIV awareness and dispel the myths that harm so many. Now that you better understand how HIV behaves in the body, the stages of infection, and how tests and treatments have evolved, the next step is to take control of your health. Prevention, early diagnosis, and adherence to treatment are essential to avoid serious complications and live a full life. Information is key to breaking myths, demystifying HIV, and helping people live without fear or stigma. So, how about taking the first step to care for yourself and protect yourself? If you haven't taken the HIV test yet, seek information on how to do it. And if you've already been diagnosed, remember that treatment can transform your life. Don't wait for the worst to happen. Take care of your health with the same dedication you put into other areas of your life. After all, health is the foundation of everything. Now, it's your turn to take action. Share this video with anyone you know who needs this information. Subscribe to the channel for more content like this and activate notifications, so you never miss tips that can transform your health and your life. Let's embark on this journey of learning and prevention together. Remember, change starts with you.